Welcome to this short presentation on digital rectal examination, or DRE, for OSCEs. The objectives of this session is to be able to understand the reasoning performing digital rectal examination, to be aware of the issues around consent and chaperones required to do this procedure, and to be knowledgeable of the procedure itself. People tend to fail this station because they fail to read the question properly, and they end up examining the prostate and going into details about that when they should be looking for issues around a PR bleed. Because of consent issues and because of lack of structure. That said, there is a very good pass rate for this station. So what are the reasons for a digital rectal examination? The list that you can see here is not inclusive, but things like suspected appendicitis, PR bleed, change in bowel habits as part of an abdominal examination, for genitourinary problems or pelvic or spinal trauma may be indications for it. The most likely ones for an OSCE, I suspect, would be look at genitourinary problems and PR bleed. Begin by washing your hands and introducing yourself to the patient using your full name and title of medical student. Confirm that you've got the correct patient by checking their name and date of birth, and then go on to explain that you'd like to perform a digital rectal examination and what that will involve. Explain to the patient that for intimate procedures it's normal to have a second person present. Gain their verbal consent to do this procedure, and then ensure the patient's privacy and ask them to undress from the waist downwards, to lay on the bed and to cover themselves up. If the scenario means the patient's under a GA, then check the name band against the patient's notes, check that the consent form has been signed and dated, or documentation done for a student to perform a PR examination under a general anaesthetic. Gathering together your equipment, you'll probably be pleased to know that this is not an ANTT procedure. You will need gauze or tissue, non-sterile gloves, and some form of lubrication. In real life, we obviously use a water-based gel such as KY or aqua jelly, but in an OSCE station, because of the models, we tend to use silicone oil. Ask the patient to lie on their left-hand side on the edge of the bed with the knees brought up towards the chest. Wash your hands using alcohol gel and put a pair of gloves on. Make sure there's a good light source and start your inspection. Inspect around the perianal area and explain to the examiner that you're looking for things such as hemorrhoids, fistulas, lesions, warts, and the general cleanliness of the area itself. Ask the patient to strain or bear down, and explain to the examiner that you are looking for any signs of a prolapse where you would expect the pink mucosa to start showing through. So, going on to palpate, lubricate your index finger, place your finger down the natal cleft onto the anal margin, ask the patient to relax and take a deep breath in. As the sphincter relaxes, advance your finger into the anal canal. Check the sphincter tone by asking the patient to squeeze your finger using their anal muscles. Rotate your finger through 360 degrees, feeling for thickening and masses. Warn the patient that you're about to insert your finger deeper into the rectum, and then repeat your 360 degree sweep again, feeling for thickening, masses, and noting any feces there. Prostate examination. Obviously, only perform this to male patients. Warn them what you're about to do. You should be able to feel the prostate through the anterior rectal wall, and you should be able to identify the two lobes either side. They should feel slightly rubbery. You should be able to identify central sulcus. If there are any masses there, describe them in the usual way. Finally, warn the patient and then gently withdraw your finger. Inspect your glove for blood, mucus, feces, and possibly any pus that's there, and tell the patient the examination is now over. Offer to wipe them or let them wipe themselves. Remove your gloves and wash your hands, and explain to the examiner any further examinations or investigations that you would perform at this point. So to summarise, introduce yourself, gain consent, and mention a chaperone. Position the patient correctly. Inspect the area. Insert your finger and palpate through 360 degrees along the entire rectum. Palpate the prostate if necessary. Inspect your finger.